institution, the MD Hospital for Diabetes. On September 1st, 1991, my late wife, Rema, whose picture is there, an ophthalmologist, she's actually the first diabetic eye specialist of India, and I branched out and started in just 2 or 3 rooms, a very, very small clinic in Royapeta. In a few years, we value to provide world-class care for diabetes and its complications. We found that we needed more and more space, and therefore started establishing branches. As we speak today, we have 49 branches in 9 states of India. It's the largest network of diabetes centers, certainly in Asia. I'm not sure about other countries. We have close to full-time staff, 130 consultant diabetologists, surgeons and others who work for us, and as I mentioned earlier, now these numbers are increasing. 470,000 registered diabetic patients in our electronic records, and this is a breakdown of the states we are currently in. So what makes us hospital days when I worked there till when we branched off, we thought we should have everything under one roof, and for some of the foreign faculty who have not visited our center, I'm sure there's a tour arranged, and many of you have also requested we can arrange a tour of the centers. What we try to do is to bring diabetology, laboratories, eyes, feet, dental, heart, radiology, nutrition, education, physical activity, even yoga and stress management, operation theatres for eye, for foot, general surgery, university, and then now the Deakin University for now 5 or 6 years now. Several students already got their PhD, so students can work here and get the PhD from Deakin. And now with the University of Warwick, the first couple of students have started, and we are constantly expanding this to other universities. This of course has led to a tremendous number of publications, journals, both national and international, or close to 800 original articles. Collaborations, this is just a very partial list and keeps getting, as I mentioned, in the UK with Warwick, with Leicester, with the Imperial College London, with McMaster, the Pure Study with Salim Youssef, University of California, the Harvard School of Public Health in our nutrition studies with Walt Willett, Emory University, one of our biggest collaborators with Professor Venkat Narayan and his team, several NIH projects funded through them, Deakin University I've already mentioned, Cardiff, UK, and others. In 2008, the WHO actually approached us, why don't you apply? And so they very soon gave us this title of WHO Collaborating Center. In 2016, the Indian Council of Medical Research designated us as the first private center in India to be designated as an official ICMR Center for Advanced Research. In 2017, at the last IDF Congress, we were already an IDF Center of Excellence in Diabetes Care. We got a re-extension of that, as well as an IDF Center for Education. The Education Academy, we started off along with the Research Foundation, which is white rice but has 5 times higher fiber content and therefore a very low GI. The GI, the glycemic index, almost equal to successful commercially as well. We also produce an atlas of Indian foods, we produce specialized footwear. So all this comes under a separate division called as the Healthcare Products Company. Finally, the poor have always been very close to us, and so from the day one, the first thing started on day one when I started in 1991 was a charitable trust. We start with cataract surgery, we just do a cataract surgery and then you send the patient home. Here, once you take on the patient, it's lifelong. You have to give the patient insulin, tablets. It's a huge expenditure. Several juvenile diabetic type 1 patients have been also taken on for lifelong. We just recently expanded that with the support of the Hinduja Foundation, who are supporting, they've agreed to support another 200 patients, and so that's going on. Over 3,000 free diabetes camps have been organized by the center. We also run free diabetes, free eye camps, and then there's a huge rural project called as the Chunamkat Rural Diabetes Project, been going on for more than 10 years now. It serves 42 villages in and around Kanchipuram district. I don't know whether I have a video on that. And this is now being expanded to include other districts as well, and this has been again written about in the Lancet as a model of delivery of healthcare at very low cost in developing countries. I don't think there's a video there, and in view of shortage of time, I'll end there and wish to thank you all for your continued patronage to the center. And as we expand, I invite you all to become collaborators in this mission to stop diabetes in India and to prevent us from becoming the diabetes capital of the world. Thank you.
Shared the stage with just last year here. and also, of course, Professor Srinivas, a dedicated neurologist, a great clinician trained at Queen's Square. But most of all, to meet Professor M. Vishwanathan, who was the father of diabetes in India. We learned so much. And I was invited to speak at Royapuram at the MV Centre, and I met Dr. Mohan. We were both relatively junior doctors in those days, and I don't need to reiterate what you have just heard. It's really a wonderful exposition of determination, a good team, and basically good organisation. I tell my students, you don't need to be bright to do research. Who some of you knew was a professor of English literature. I'm a dropout in the family. My whole family is in English literature. I apologise. But he was a world expert in D.H. Lawrence, and he spoke to the Madras Philosophical Society. Once we were in adjacent lecture theatres, and you'd soon realise if you got to the wrong...
Mr. J. Ganesh for transportation arrangements, and finally Shankara Visions for the splendid photography. We heartfelt gratitude to all our sponsors, Messrs. Novo Nordisk, MSD, Novartis, Sanofi, Eli Lilly, Lupin, Eris, Zydus Cadila, J&J, Sun Pharma CVS, Glenmark Healthion, Medtronics, Cerdia, Boehringer Ingelheim, Ordain Healthcare, Franco Indian, Abbott Diabetes, Wockhardt, Diabetic Foot Care, M-Cure.
Next I call upon Dr. Robert Keppel. Honorary request Dr. Robert Ratner, Professor Department of Medicine, Georgetown University Medical. Honorary request Dr. Alan Hirsch. Next.
Corona, Procor, Primus, MacLeod's, Hetero, Zydus Wellness, Alchem Diabetology and Panacea Biotech. Special thanks are due to Mr. Mabin Phillips and the banquet team of Dr. Hotel.
இந்தியாவில் இன்றைக்கி 7.5 கோடி மக்களுக்கு நீரிழிவு நோய் இருக்கிறது. அதாவது 75 மில்லியன். கூடிய சீக்கிரத்தில் சைனாவை கூட நம்ம பீட் பண்ணிவிட்டு நம்பர் 1 டயபெட்டிக் கேபிட்டல் ஆஃப் த வேர்ல்டுன்னு சொல்லி இப்போ வரப்போகிறோம். இது பெரும்பாலும் லைஃப் ஸ்டைல்னால எக்ஸசைஸ் பண்ணுறது இல்லை ஆளுங்க, நிறைய அரிசி சாதம் சாப்பிட்றது, உடல் பருமன் அதிகமாகிறது, இதுதான் முக்கியமான ஸ்ட்ரெஸ், வேறு டென்ஷன்லாம் வருது. இதெல்லாம் எப்படி வருது, எத்தனை வகையான நீரிழிவு நோய் இருக்குது, எப்படி தடுக்கிறது, எப்படி புது புது சிகிச்சை முறைகள் என்னென்ன வந்திருக்குது என்றதை டீச் பண்ணுறதுக்காக டாக்டர்ஸ் பூரா இந்தியா பூரா வருவாங்க இந்த மீட்டிங்கு. இது 6வது முறை இது பண்ணுறோம். இந்த தடவை ரெக்கார்ட் அட்டெண்டன்ஸ் வந்திருக்கு. 3000க்கு மேலே டாக்டர்ஸ் வந்திருக்காங்க எல்லா மாநிலத்தில் இருந்தோம். அண்ட் இது ஃபாரின் கெஸ்ட் யூஎஸ்லேருந்து யூகேலேருந்து எல்லாம் வந்திருக்காங்க. ஸோ இந்த 3 நாள் இந்த கான்ஃபரன்ஸில் நீரிழிவு நோயை கம்ப்ளீட்டாக எப்படி கட்டுப்பாடில் வைக்கணும், எப்படி தடுக்கணும், இதனுடைய சிக்கல்கள் எப்படி ப்ரிவென்ட் பண்ணுறதும் இதெல்லாம் ரொம்ப டீட்டெயில்டாக சொல்கிறோம். இப்போ ஒரு புது இது இப்போ தான் நடந்தது. அதாவது டான்ஸ் மூலமாக, தாண்டவ்னு சொல்லி ஒரு டான்ஸ் ப்ரோக்ராம் மூலமாக, ஏன்னா நிறைய பேர் நடக்கணும்னு சொன்னால் போர் அடிக்கும், சின்ன குழந்தைங்க அடல்சன்ஸ்லாம் நடக்கிறது ரொம்ப போரிங். அப்போ ஒரு 5 மினிட் 10 மினிட்ஸில் டான்ஸ் நீங்கள் பண்ணிட்டீங்கன்னா ஒரு அரை மணி நேரம் நடக்கிறதுனுடைய ஈக்குவலண்ட். ஸோ அந்த மாதிரி புது எவ்ரி இயர் புதுசாக ஏதாவது ஒன்று கொண்டு வருவோம். இந்த மாதிரி கொண்டாந்துட்டு நீரிழிவு நோயை எப்படியாவது கண்ட்ரோல் பண்ணோம். இந்த மோட்டோவே பார்த்தீங்கன்னா, லெட்ஸ் டிஃபீட் டயபெட்டிஸ், வி கேன் அண்ட் வி வில். வெல்ல முடியும், இந்த வியாதி டெஃபினட்டாக நம்மளால் கண்ட்ரோல் பண்ண முடியும், டிஃபீட் பண்ண முடியும்ன்ற அந்த தீம் தான் இந்த கான்ஃபரன்ஸ்க்கே வச்சுருக்கு.